Well, dentists in the tri-state are now back in business, taking patients for routine checkups. But the World Health Organization now says people should put off their routine checkups in areas where the virus is spreading. The American Dental Association says they strongly disagree with that guidance. And earlier I talked to Dr. Melissa Santilli, who graduated from Johns Hopkins University and then attended Indiana University School of Dentistry. She also disagrees with the World Health Organization. Dr. Santilli, thanks for joining us tonight. Talk to us about your thoughts on the World Health Organization's recommendations to put off routine checkups in areas where they say that the virus is spreading. I guess first, what is considered a routine checkup and what would you tell your patients?
So a routine checkup is when people would normally go to their dentist twice a year, or some patients might go a couple more times a year to get their cleaning and to take x-rays and check to see if there's infections in the teeth. And so I feel that with the recommendation they're saying, I don't think it's evidence-based. There's no actual cases of COVID coming out of dental offices as a source of spread. But telling people, to avoid the dental office, there's a lot more issues with that, because when people go to the dental office and get these x-rays done, that's when the dentist can actually see where the infection is going, if it's a threat to this person's health. And so it's a really important preventative care to prevent people from showing up in the ER with abscess and pain that's unbearable and taking up space that do belong for the COVID patients. So that's why I disagree with the recommendation, because I feel like it's just creating unnecessary paranoia for a health preventative thing that's really important for people's health, especially because your mouth is the window to your body. People really need to keep up with their oral health, even for the rest of their body health as well.
And Dr. Santilli, you talk about that preventative dental care. Will it just make things worse if an individual does put it off, or what does the outcome look like there?
Yeah, so with dental care, when they go into the dentist will take x-rays and see what's going on. And in the tooth, whenever the bacteria gets too close to the nerve, it can then get into the nerve and abscess, and then that goes into the bone. And then now this person will need antibiotic. They're going to wake up with a swollen face. So it's better to catch the problem before it gets to that point, because at that point they're in pain. They can't even function. They have to show up in the ER, and it's taking up space that really belongs to the patients that need it for serious problems, as well as just not getting their preventative care, such as cleanings and fillings and some basic procedures that can prevent bigger problems down the road. Especially if they're allowing that bacteria load to accumulate in their body. It's hard on the system to handle all that plaque that's in their body. It's millions of bacteria in their mouth, and they're still eating with their mouth, and it's putting a lot more stress on their immune system. But I do understand there's people that do have immunity issues that want to avoid going out, and I totally agree. That's why we also offer virtual consults, which a lot of dentists are doing as well. That's kind of video chatting like we're doing right now with patients at home to help them take care of as much as they can without having to come in. But if there's an active infection, it's really important to get that taken care of as soon as possible, so it doesn't get to the point where you end up in the ER for a dental problem.
Right, and what's your biggest advice then to patients during this pandemic that may be worried about coming into your office?
So I wanted to reassure everyone that dentists, beyond any other place, like if you go to Walmart, you're not as protected as you are at the dental office. The reason is because the dentist, right now, we're wearing full face coverage, hair, feet, all the way from, there's really nothing exposed on our entire body. When we interact with patients, there's a face shield, there's masks, there's all these things to prevent any kind of transmission between human to human. But it is true that we do have to go in the mouth and take care of the diseases in the mouth. But dental offices are very, very strict with all the extra precautions they're taking. So I do think that people should trust that system, that we are making sure that nothing is transmitted between patients and that we're fully geared to handle any kind of, our PPE is tremendous. Like if you go to any other service industry right now, with any kind of close contact, you're not going to get that amount of PPE that's worn in the dental office.
Well, dentist Melissa Santilli, thank you so much for your time and your insight tonight. We appreciate it.
Thank you so much.